Welcome to the mental health video series for people living with diabetes. My name is Candace and I'm from Diabetes Canada. Talking about your diabetes care with your support team can be challenging, especially when stigma can get in the way. This session will provide strategies for engaging with your healthcare team and others who support your management to ensure your needs are met. Cassandra Millen, registered social worker and psychotherapist with over 15 years of experience, has been living with type 1 diabetes for nearly 30 years. She will explore how person-centered care approaches can help people with diabetes have confident conversations with their healthcare team. Over to you, Cassandra.
Hey, thank you so much for being here. We're so excited to be able to offer this um, because we know how difficult these conversations can be to have in the context of healthcare. It's hard to speak up and it's hard to kind of know if we're allowed to say things or what we're allowed to say. And so today we are going to talk about how we have more confident conversations with our providers and with our care teams so that we really feel like our healthcare is working for us as well. And so just an overview of some of the topics that will be covered today. We will spend some time just talking about what is person-centered care and how do we as patients and people fit into that. We'll also spend some time talking about how do we manage stigma around living with diabetes, whether that's type 1 or type 2, when it comes up. And hopefully it's not coming up as often, but it's really difficult sometimes when it does. We'll also spend some time today talking about how do we speak up? Okay, what are some things that would be important to know so that we can empower ourselves to have these conversations with those on our care team and those who are in our circle when we are maybe intimidated to do so or feel like we don't have a right to speak up or we feel like we might not be heard. And then what are some actual strategies that we might have to start these conversations? What are some ways that we can present our personal experience as somebody living with diabetes? First, we want to talk about person-centered care. And oftentimes, person-centered care might be thought of as, you know, the person living with diabetes has full decision-making power. And what we really mean with person-centered care is that there's a recognition that individuals are a valuable part of their care. They're a valuable resource, you're a valuable source of expertise. You are the expert of your life as the person living with diabetes. And we want to blend that into this matrix of clinical expertise, what your provider also knows and what they bring to the table, as well as research-based practice, right? What has years and years of research shown us can be effective and helpful. And when we can put all of these things together, we can really land in the center of the Venn diagram that you see here. And it honors that what works best for somebody else might not work best for you. And that's also a valuable source of information and a valuable source of knowledge. When we talk about person-centered care, we talk about understanding the context of your whole experience. And so some examples of that might be, if you're a single parent and living with type 1 or type 2 diabetes, and you have, limited support overnight, and maybe you have young children. For you, it might work a little bit more effectively to have your blood sugars in a different place than somebody else going to bed. And that understanding and being able to talk openly about that would be an example of your experience, you knowing yourself and your needs best, that your provider might not know. And then when they say they might not know, it's not that they might not care, it's that they just might not have thought of that. Or maybe you're an athlete who needs your blood sugars in a certain range in order to perform in the ways that you want. And it might be a little bit different than what research suggests. And you recognize that that's what works best for you for whatever reason. These are all examples of you knowing yourself well as a person living with diabetes, and that source of information and expertise is highly knowledgeable. when we talk about person-centered care, we really want to anchor into this idea that we're having conversations to learn and understand, not conversations that are based on telling somebody what to do, right? Having conversations in the sense of learning to understand, not learning to respond. And I think when we can integrate that into the patient experience by advocating for ourselves, then we can start to feel less isolated in our care. And when we feel less isolated, we are at lower risk, perhaps, of things like diabetes distress or other mental health challenges that might come with living with diabetes. Right? We might feel less anxious going to an appointment when we feel like our experience and our expertise on our own selves is being heard. When we can feel like a part of our care, we also are in a position to perhaps feel more connected. And from a mental health standpoint, we know that connection is so vital when we're working through difficult things. It is one of the things that really anchors anybody into not having as long term or as negative, perhaps, repercussions of something really difficult. And so when we can have these conversations, when we can feel like we are involved in our care, when we can feel like our experience matters, um, then we're at lower risk of feeling disconnected, lower risk of feeling isolated, lower risk of feeling alone in our journey as somebody living with diabetes. So when we think about stigma with diabetes, I think, if you're watching this, most likely you've experienced it. And stigma, in its purest form is really just this mark of disgrace or shame that comes with a particular circumstance or quality. And it's way more common with diabetes than I think anyone would like to admit. And some things that can often drive stigma might be the perception that a medical professional is the expert, as opposed to what you can contribute, as we talked about a few minutes ago with person-centered care and a person with that personal lived experience. Lack of awareness or lack of knowledge around the experience of diabetes can also drive that experience with stigma. And, I'll share an example of when I was in high school. I had a science teacher who was talking about his weight loss journey and how he cut out sugar. And of course, he had to cut out sugar because if if he ate sugar continuously, then he was no doubt going to get diabetes, right? And, all with good intentions. I'm very well aware of that. But as a 16-year-old in the back of the science class, when you see all the heads turn back and start asking you, oh my gosh, is that why you have diabetes? Did you eat too much sugar as a kid? These are things that come up, and unfortunately, for a lot of people, have also come to either be expected or normalized in the experience of living with diabetes. And again, this is not unique to type 1 diabetes or type 2 or gestational. It happens across the board. Sometimes personal health beliefs for people that are important to us might also filter into our relationships, which can enhance that sense of stigma. And access to credible information. And so there's a lot of wonderful resources out there on the internet. And there's also a lot of misinformation on the internet about things that might lead to the development of diabetes or what is appropriate care or what puts somebody at risk. And all of these things can contribute, again, to that purest form of stigma, which is a sense of disgrace related to having or living with diabetes. There's also a lot of confusion around the different types of diabetes. So there are significant differences in some ways between type 1 and type 2. And that confusion can again fuel that stigma of living with diabetes or how you manage your diabetes. As a type 1 diabetic, I often get asked by people that I know with type 2 diabetes around management, and it can be different. And I think even, in the context of people living with diabetes, there can be some confusion about the differences that again has high potential to increase some of that stigma or that sense of being judged or some of that shame in some aspects. Sometimes stigma can also lend itself to you as a person living with diabetes. When there's high stigma or even an isolated experience of being stigmatized as a person living with diabetes, misinformed judgment, a comment about someone's sugar consumption leading to the development of diabetes, all of these things can lead to unhelpful belief that diabetes is the individual's fault. When in reality, we know that there's lots of things that might contribute, and we also know that in some circumstances, we don't know what contributed. And the risk that we run when we start to internalize that belief or some of these stigmas that come up in our everyday interactions is we start to experience high shame or self-blame. We start to disconnect, or we might feel more isolated. We might feel like other people don't understand, or what's the point in sharing? Or we might even come to expect these things to a point that it's normalized and we don't perhaps deal with it in the ways that are helpful. And all of these things can contribute to more significant challenges, perhaps with things like feeling anxious going to an appointment, difficulty talking about diabetes with others, worries around being judged if we share that we have diabetes, all of which I think we can all agree are not helpful in the context of mental health. Okay, so we start to internalize it, we start to expect it or normalize it, we start to feel like we're part of the problem or we are the problem. Or we start to blame ourselves, which is also a really tricky and unhelpful place to be. I think another example that's worth mentioning is often women who have diabetes in pregnancy, whether they've developed it before, whether it's gestational diabetes. There's this stigma that they will have bigger babies, and I think the research shows that. But if you have a bigger baby, often the question might be, gosh, where your blood sugar is out of control. And that's not a helpful question, and it also might not be accurate at all. And so I think this is just a really good example of that stigma that could leave that mother, who just had a baby, feeling like something was their fault. My baby was bigger because I didn't do something, as opposed to the reality of it might not have been the case at all. Baby could be perfectly healthy. But that's, again, is just another example of how common that stigma can be. And it's most often not ill-intended, but the way that we perceive it or we internalize it can be really challenging. So how do we speak up, right? Or why is it important that we speak up so that we can get care that really works and makes sense for us? When we start to internalize that stigma, as we were just talking about, that can really deter somebody from speaking up. Can also lead to feelings of hopelessness, or that sentiment of what's the point? No one's going to listen, or I'm not going to feel heard. No one gets it. This isn't working for me. These are all examples of perhaps a felt sense of hopelessness that can also deter us from advocating for ourselves, speaking up to get care that really makes sense for us. It's important to speak up even when we feel this. That's usually a good indicator that we need to speak up because our situations do change and we need to acknowledge that for ourselves. We also need to acknowledge that it's okay if our situation has changed. And we need to communicate that with our healthcare team because they may not know. Right? If you haven't seen your healthcare provider for a number of months, they might not know that your situation has moved in this way, or that you're dealing with something else, or that your support system has altered in some way. And so it is important that we let our healthcare providers know these things. I think it's natural as an individual to have our own assumptions about how our healthcare providers might work with us. And, that connects back to what we were talking about with stigma. And sometimes that, power imbalance of, well, this is the doctor, this is the expert in their field. Who am I to come in and share my personal experience that might not completely connect with, what I'm anticipating they might say. But when we can start asking those questions of how would this fit in if this is my experience, then we can start to open the conversation up to do things differently. At the end of the day, any individual or any patient has the right to feel heard and to ask for what they need. And it doesn't always mean that these things play out in the ways that we might expect, because we might get an answer that we hadn't thought of as an individual or as a patient, but it helps us feel more connected to our provider um, when we can start to really help them to understand as well how that would unfold in our unique circumstance or our unique situation or life, right? I always think, the thing that always comes to mind is we don't know what we don't know. And that's true for us. And that's also true for our healthcare providers who are trying to help us. And so it is important that we try to speak up and let them in on what that looks like in our own world. Asking for what we need can lead to powerful conversations. As I was saying earlier, our healthcare provider might not know if things have changed in our life. And by communicating that to them, we can start to open the door to a different conversation of how do I make this work? Right? I hear what you're saying, and we'll talk about this a little bit more in a few minutes, but I hear what you're saying. And these are my concerns about what that looks like in my life, right? How can we figure this out together? I think it's always worth shining a light on that these conversations can either empower us to speak up more, or they can push us back into feeling a little bit hopeless. And sometimes it's not just speaking up for our needs or speaking up with questions about how does this fit into my particular circumstance, but also letting providers know if something that they've said is leaving us feeling less inclined to share more. And that can feel like a really difficult thing to approach. And a little bit later today, we'll spend some time talking about how to approach that conversation. It is important to do it because if we're feeling judged, if we are feeling stigmatized, if we're feeling unheard, these are the barriers that we want to break through so that we can be part of that system that is person-centered care. Right? Language does matter. And sometimes someone who maybe doesn't live with diabetes might not be as aware of that. And we have an opportunity to inform them of that in that moment in a way that is going to help us get the care that we need and the care that we deserve. I think it's also important as patients to recognize on that note that sometimes things might be said without ill intent, with no sort of malice behind it, just that lack of understanding, lack of awareness of that lived experience that we talked about earlier when we were talking about stigma. Okay, so how do we start these conversations with our care team or our healthcare providers? I think, it's easier said than done when there are those power imbalances that we talked about, or when we come into an appointment or, come into a meeting with our healthcare team, perhaps carrying some of that stigma that may not even have anything to do with our care team. Um, you see the examples on the screen here, and I'm going to just talk about a few of them. I think, sharing our intentions and clarifying our expectations is always a good place to start with healthy communication. And so I do recognize that this is important. I recognize the importance of doing these particular things for my healthcare. And I also notice that I'm having a hard time making this fit in my life at this point in time. Right? So I'll go back to the example from earlier today around, a single parent who might let their blood sugars run at a different level than is recommended overnight, right? Because perhaps they're worried about how that might impact their young children. If they were, needed and they're prone to low blood sugars overnight, or when they drop significantly and they drop quickly. And so communicating, I recognize the importance of having my blood sugars in this range, and I'm really, having a hard time making that work when I don't have someone else there to care for my children in the night if I have a really bad low. And so sharing that with authenticity, with honesty, again, that might also just look like I'm really worried about this blood sugar range or having my target overnight being this value because of these reasons. Other ways might just be approaching with curiosity, right? Is there another way to do this when I'm not feeling comfortable, right? These are the ways, or these are the reasons why I don't feel comfortable, right? Is there flexibility in how we could approach this goal? And perhaps the most difficult one, and arguably maybe one of the most important, is if we are feeling judged or we're feeling blamed for aspects of our care not going the way that, most likely we all are hoping for, is communicating that and really just clarifying our understanding that this most likely was not the intention, right? I know that this probably wasn't what you meant. And I also know that in this moment, I feel like I'm being blamed here, or I'm really noticing that I'm feeling like I want to pull back for these reasons. Those are most often the hardest and the most important conversations to have so that we can reconnect with our healthcare team and they know where we're at in some of these conversations as well. I think at the end of the day, it is important for everyone in this space to hear that you are allowed to say these things. You are allowed to speak up as the expert in your own experience. And maybe that doesn't always mean that things change in the recommendations that are provided. It just gives a space and a platform for everyone to be on the same page about where you're at and what makes sense for you as a unique person living with diabetes. Again, linking this back to, where does this fit in the mental health conversation? When we don't feel heard, when we feel judged, when we feel like we can't speak up, when we feel scared or worried or fearful about some of these recommendations, all of these things are going to impact our day-to-day relationship with ourselves. And I'll reiterate one more time, that can lead to anxiety or feeling anxious going into appointments. That can lead to increased feelings of isolation. That can lead to increased feelings of shame if we're leaving an appointment feeling to blame without a conversation about it. And all of these things have significant impact on our mental health. Some other strategies that can be helpful when we are advocating for ourselves is having someone come with us to our appointments who might be able to kind of further the conversation if we are feeling stuck, or who might know that we're a little bit nervous going into the appointment and that we might not communicate things in the ways that we hope, or we might feel a little bit nervous about speaking up because of some of those power imbalances that we talked about. And so having someone come with you can be a really helpful strategy just to navigate that. Writing down your questions and concerns ahead of time. I think most of us have probably been in a situation where we have lots that we want to ask, and then we get in the groove of the appointment, or maybe some of those again, stigmas or that sense of shame or self-blame come up. And we feel like we don't have the right to ask or the right to speak up. And so we kind of lose our script. And so writing those questions down ahead of time can help us stay on track with the things that we really want to make sure we're putting forward in some of those appointments. And then also asking for a record of the plan that was discussed in that appointment. A lot of times, so much is discussed that we might forget things. Or there can be a fear that if we have to meet with somebody different the next time, that plan or that discussion about some flexibility to meet the same goal that fits for us as a unique individual won't be heard the next time. And so if we can ask for a record of that plan, that keeps everybody on the same page, even if some members of our care team are changing along the way. At the end of the day, as a person living with diabetes, your perspective and your voice matter. You are a part of the team. You offer an expertise that nobody else has, and that is your own knowledge of yourself as an individual. That is your knowledge of what works for you, and what makes sense or what fits in the context of your life and your circumstances. And it is your right to speak up, to let others know what that looks like, right? Our healthcare providers and our care team, they might just need our help to understand what our concerns are or what some of those circumstances are. That might mean that, perhaps we don't have the finances to eat fruits and vegetables at every single meal, fresh produce at every single meal. And they might not know that without us sharing that. That might mean, letting them know that our support system has its limitations at times. And how do we work with that, right? If we're the person really kind of doing this on our own. Or that might mean, for athletes, again, right? How does my body feel if I'm trying to go into this sporting event at this particular blood sugar versus this particular blood sugar, right? And so coming at it from the lens of simply just that our healthcare providers do need our help to understand what that experience is like for us, and not going into it expecting that they know, but rather going into it expecting that they don't know and seeing it as an opportunity. And at the end of the day, I think, really anchoring into this understanding that research and best practices and our lived experience as an individual living with diabetes, that person-centered care framework, they really can work together. And these are the ways that they can. And it is important that they work together for our mental health as we navigate living with diabetes.